millions, which is prevention. So joining me to talk about it in Studio 61 is Dr. Rani Tallapureddy. Thanks so much for being here.
Thank you for having me.
So who should be screened for breast cancer?
Screening depends on your risk. Average risk individuals, it's recommended to screen between 40 to 50 years every year.
Okay.
And beyond 50 to 75, it's recommended to be done every 1 to 2 years based on your risks and discussion with your primary provider. And
what if there's a health history with your family?
they are considered as high-risk individuals,
Okay.
and those patients should be screened based on their risks.
Okay.
And if you have a family history or BRCA gene mutation, then the recommendation would be earlier screening and based on the earlier onset of breast cancer in the family.
The mid-30s or even earlier than that?
25 and
really?
above, yes.
Okay, that's good to know. What about screening methods? Which ones do you recommend?
There are most commonly used is mammography, which is low-dose X-ray screening.
Okay.
However, it's less. The other alternative is ultrasound.
Okay.
And for patients with dense breasts, ultrasound is much better compared in addition to mammography. And MRI of the breast is another alternative for high-risk individuals.
And how often should you be doing this? Every couple years?
Yes.
Once you pass that 40-year mark?
Yes.
What about self-exams? What should people be doing at home? What should they be looking for? I know we talk about lumps. I mean, how do you define a lump? But what is an area of concern?
Clinical breast exam is not a standalone test by itself, but however, knowing your breasts, making sure that you know them so you can bring it to your provider attention when you feel a lump. Usually, even mammography is a screening, but a lot of them are brought by patients when they feel a breast lump.
So anything that feels off, feels different, change, maybe hard tissue, something like that?
Yes. And it's important to know your breast so you can bring it to the attention of the provider.
And is it ever too early to detect something like this?
Early detection improves survival, and there's a significant improvement in survival from 99% to 36% based on how early it's detected. And it also improves the burden of care, and early detection is important.
What about lifestyle changes? Are there changes in diet or perhaps more exercise that could reduce our chances of developing breast cancer?
Maintaining a healthy lifestyle, cutting down your alcohol intake, avoiding smoking, and breast screening in between screenings is very important for early detection.
What are the most common signs or symptoms of breast cancer that you typically see in your office?
Most common sign, usually it's asymptomatic, and by the time that's the point of screening mammography, to pick it up earlier before it presents itself.
And so this is Breast Cancer Awareness Month. Do you have a final message to our viewers?
Make sure you be up to date with your screening, and every year if you're at an average to high risk.
Dr. Rani Tallapureddy of South Windsor, thank you so much for coming on the program and telling me these helpful tips. It's so important and could even save a life. So thanks a lot.